EMP for nursing. EMP for nursing is a relatively new area of specialty within ESP. It focuses on nurses' use of English in clinical settings and nursing education as opposed to other healthcare professionals. Many books in recent years have been published for the nurses entering the inner circle workforce. Less recognized are English as a second language immigrants and the international students in the inner circle who wish to do their majors in nursing in 2 and 4 years university courses. Various needs analysis have been carried out to find out what are the most challenging issues. These have been identified as academic, discipline-specific, cultural, related to language. Research of need analysis has led to a more understanding about the nursing discourse and the development of a taxonomy of language of nursing. The academic skills which are needed for nursing are the same as those needed for other humanities and social sciences subjects. For example, using the reading strategies and skills to use complex texts, especially case reports and patient histories, listening effectively to lectures and taking notes in order to supplement the lecture outline, study effectively for tests, to participate actively in discussions, to ask questions regarding diagnosis and intervention and the treatment of patients, write research papers, and read and write critically. Discipline-specific skills for nursing have been identified as the nursing healthcare plans, which students find quite difficult. Students here are required to research the diagnosis which has been given for a patient, then create appropriate and desired goals and outcomes for the treatment, and then implement the interventions that have been identified. After this, to evaluate the progress as regards to the goals and outcomes of that particular intervention and treatment. Then discipline-specific skills needed are charting, change of shift reports in which they have to document all the different information regarding the patient's treatment and position, interviewing skills to get information regarding patient's history, regarding their ailment, assertive skills to speak up in difficult situation, and therapeutic communication skills which are needed in order to comfort the patient. Cultural skills and content which are required are that the nurses become a part of a discourse community. If they come from different culture, then there are different cultural assumptions regarding mental illness, regarding sexuality and concerns, and death and dying. So students who come from a different cultural background, they have a difficulty understanding these concepts and responding to them. The cultural expectation and communication style required them to be assertive and self-directed in some cases, but students who come from a different background where standing up and to themselves and asserting themselves is viewed as lacking respect towards their seniors and their supervisors. Lack of initiative on part of the students can be viewed by supervisors with a Western background as not participating actively in the situation. Speaking for themselves also, sometimes there is reticence on part of the students who come from an Asian background. So this could be viewed negatively by the supervisors and seniors because perhaps it is viewed as lack of knowledge. Language skills and tasks which are required in clinical settings and interaction with clients includes asking information from the patients, giving instructions, responding to questions, suggesting, describing, and so on. Similarly, receiving and making phone calls, carrying out small talk about social issues, topics, discussing various things, comforting, asking help, clarifying, and apologizing. Similarly, the skills needed for social interaction would include conveying information to patients and their families, good and bad news, diagnosis, then presenting cases, justifying and challenging representation of facts, dealing with interruptions, negotiating difference of opinion, giving information to others, and using reported speech. Interpersonal skills in using English, how to express empathy in English, offer reassurance, interpret nonverbal cues from the patient, clarification devices, paraphrasing speech, using assertive response, and summarizing. So the needs analysis so far done on the nursing education has revealed that they have to identify language tasks, have identified language tasks and skills. And the most challenging amongst this is asserting oneself to patients, to co-workers, and to instructors to communicate effectively and to understand non-standard language.